Niall Dickson is Chief Executive of the NHS Confederation. Good morning, Neil.
Good morning.
How did you come to this projection?
Well, this work was done by the Independent Health Providers Network, which is part of the NHS family. It builds on work that's already been done by the Nuffield Trust, which is looking at what we went into at the beginning of this pandemic, which indicated that we had more than 4 million people on waiting lists. That's likely to double over the 3 months. And then through the rest of the year, we anticipate that these figures will continue to rise. There's no doubt that we are facing a health service which has got thousands of very sick and recovering COVID patients. We're running COVID and non-COVID services. We're having to maintain social distances in general hospitals, psychiatric wards throughout the whole service, and still using protective equipment and heightened infection control measures. So you can see that as we try and restart the health service for the many services which have been paused or stopped, we are going to face a very difficult process of getting this in place. And we certainly want to see the government renew their agreement with the independent sector, because frankly, we need all the capacity we can get to try and build up services going forward.
Would it, if that does happen, how far does that go to change this particular projection? What would that do to the numbers on waiting lists?
Well, I think it's possible we might go to a lower figure by the end of the year. And these things, frankly, are very difficult to estimate, particularly at the moment, because we're not entirely clear what the levels of demand coming out of this are. We, of course, know patients that were waiting beforehand, but of course, we've now got a huge backlog of patients that we haven't seen, and we don't know what their needs will be. So rather than sort of play around with individual figures, I think it's fair. The point that we're very clear about getting across is there's going to be huge pressure to get waiting lists down. There's also, frankly, going to be huge pressure in other parts of the service. We shouldn't just concentrate on waiting lists or hospitals, but also look at what's happening in community services and primary care. Because in all those areas, the ability of the service to meet demand and growing demand over this period will be severely constrained by the fact that the COVID is still around, so we're still treating COVID patients and recovering COVID patients, but we're also obviously dealing with this unmet demand which has built up during this period, as well as inheriting what happened before COVID, which was already a service under great strain.
Indeed, a lot of people waiting longer already than the NHS's target of 18 weeks for all types of non-emergency surgery. I just wonder if you can explain, I mean, COVID cases, you say it's still around, and of course it is, but the number of cases are coming down. How do things like infection control measures affect how many patients the NHS can see?
So, for example, you might have a 6-bedded area within a ward, which might have to become a 4-bedded area. So that reduces you immediately. In terms of infection control, there are a whole series of issues. I'm sorry, I'll try and switch this off.
It's okay, we're used to it. It does happen on air quite often these days.
It's the BBC, needless to say. But yes, just to say that there are a whole series. Sorry, I'll just try and get rid of him. That's fine.
One of our colleagues. I'm sure they'll understand.
I'll try and switch him off if I possibly can. So yeah.
But those infection control measures really affecting the numbers of people who can come in, and they will have to stay, will they, until the danger of a second spike has passed?
Yes, I think that's absolutely right. So as long as the virus is around in the community, and the virus, remember, we are concerned is also around medical facilities, both care homes and hospitals and so on. That's a particular area of concern at the moment. So obviously maintaining those infection control measures is really important, not just for COVID patients and so forth, but for non-COVID patients and for staff and for all those who are using hospital and other facilities, NHS facilities. So you will require these infection control measures, which also include obviously using PPE, and PPE itself, this protective equipment, affects how you're able to deliver care.